The most interesting thing to me, I mean, from a clinician, the obvious things that I've seen are significant improvement in bone density. I've seen reversals of osteoporosis and osteopenia and those sorts of things. But really what's been the most interesting for me is, and I'm not even sure I was really looking for this when I started using this form of therapy, but what I've seen is a large number of my patients coming back into the office and telling me they feel like themselves again. They feel more feminine, they feel like they're more connected with their surroundings and with the people that they relate with. Their sense of femininity is increased, and that's been remarkable. I mean, that's been such a remarkable change from what I was doing when I was using low-dose static hormones. My initial consultation is an hour, and I spend a lot of time talking about those things and talking about the difference between low-dose static hormones, which is sort of the standard regimen that's promoted by the mainstream, and then my 15 or 20 years experience with that, and then the last 4 years that I've had with the rhythmic. And then I try to weave in some of the physiology of what rhythm does, you know, the importance of peaking estrogens and peaking progesterones and the turn on and turn off of different things. And then I just sort of show them that my experience has been so much better in terms of trying to reverse some of the things that women are suffering. And so I focus more on that. And of course, I'll refer them to T.S. Wiley's books and to read if they really want to understand a lot of what's going on and that sort of thing. I think probably the most remarkable thing for me is, you know, when you provide health care for women and they come in midlife, they're looking for some sense of restoration of themselves. And I was unable to achieve that significantly with the hormone regimens that we use more mainstream today. So for me, when I come in and have patients that now tell me that they're more happy and their relationships are better and their view of their life is better, then that to me is amazing. And then things like reversal of, you know, bone loss and of course normalization of body composition and those sorts of things are just sort of icing on the cake.